An ingrown toenail is when the nail starts to curve in or cut into the tissue that's adjacent or next to the nail, and it can be very painful, causes inflammation, redness, sometimes even bleeding or infection in the area. And most of the patients that I see have seen other providers and have been sent to me for definitive care for a procedure to alleviate the problem. Ingrown toenails are a very common problem, a lot of times in children, but frequently in adults as well. Sometimes shoes or injuries can cause a toenail to start to ingrow. Sometimes it's even genetic from the shape of the nail. Typically, the initial office visit is for evaluation procedures and to discuss what the proper form of care would be. Sometimes that includes antibiotics, a temporary procedure to alleviate the actual ingrown portion of the nail, and other times it can be a permanent procedure to permanently change the shape of the nail to prevent future problems. A permanent toenail procedure is an office-based procedure, typically takes about half an hour to complete. A local anesthetic is injected into the base of the toe, and the toenail is removed, and a chemical is placed at the root of the nail to prevent future growth in that area. Typically for an ingrown toenail, just the side can be removed and permanently alleviate problems. In some cases, the nail is so deformed that the entire nail has to be removed, and people function very well without a toenail long term. It doesn't cause any long-term pain problems, and compared to what was there before, it typically feels better even with an injury. I think the first line of therapy for an ingrown toenail should be Epsom salt soaks, whether it's infected or painful or not.